On rising coronavirus infections, even as countries across the continent are reintroducing restrictions. Many health authorities are pointing the finger at young people who they say are unknowingly spreading the virus. Evelyn Laverick reports.
Spain's Basque Country is restricting gatherings to no more than 10 people as the region battles its COVID-19 crisis. It's the second worst hit area in terms of per capita infections. But Spain as a whole has become the European country registering the most COVID cases per 100,000 inhabitants in the last 14 days. Its rate has risen to just over 132. Luxembourg is second with 98 and Malta third with 88.5 per 100,000 people. Austria has now joined a number of countries adding restrictions on travellers coming from Spain.
Ganz konkret wird es
There will be a travel warning from the Balearic Islands starting on Monday. This means that all people who are currently on holiday there can of course still continue their holiday. Those who return after Monday are obliged to get tested and go into 14 days of quarantine.
Montag zurückkehrt, ist verpflichtet, sich testen zu lassen oder
Ireland has announced that restrictions are being significantly tightened after seeing the number of cases increase rapidly over the past 2 weeks. Health experts say spikes are being driven by the under 40s, many of whom are unaware they're infected and are disregarding social distancing. Ireland has reacted by urging working from home and limiting social mixing.
This is not just about the appalling behaviour we saw in one Dublin bar at the weekend. The evidence is that a large number of people are acting as if the virus is no threat to them or that it's okay to take a few more risks.
Mask wearing is increasingly being seen as a partial barrier to passing on infections, while France has now said it will make wearing face masks compulsory at work. In Rome, wearing masks in public places is being strictly enforced by the police. Evelyn Laverick, Euronews.
Well, as the number of new coronavirus infections starts to rise in many European countries, experts are warning that the continent may be risking new winter lockdowns, the cost of easing restrictions during the summer months. Well, joining me now from Copenhagen to discuss the issue of COVID and summer holidays is Dr. Jeffrey Lazarus of the Barcelona Institute for Global Health. Thanks very much for joining us on Good Morning Europe. To what extent have summer holidays and tourism been contributing to the spread of the virus this summer?
It's certainly been contributing. The question is really how much. Particularly in Spain, there's a different situation going on. Confinement was so long and so draconian that when it was finally lifted, families came together for the very first time. So there was a big intermixing of young people and older people, particularly around San Juan, the solstice holiday at the end of June. So that probably contributed quite a bit to the spread. Another part of the spread is also related to farm workers in the north of Spain. They've been documented as living in very poor and crowded conditions. So otherwise, I'm not sure how much Spain is different than other countries. There's, of course, the problems that you just reported on in bars and restaurants that aren't taking the necessary precautions. And that's something that's, I think, rather a quick fix for governments to do by making waiting lines in the bars and restaurants, separating tables, being clear where to enter and where to leave. So tourism is contributing, but I'm not sure it's contributing as much as some people think.
In Spain and elsewhere, however hard the lockdown was, were restrictions eased too soon, do you think?
It's hard to say. I think they were eased rather quickly without all of the precautions being put in place. So in Spain, we know that the number of contact tracers that were needed in the absence of having an app that could do contact tracing was not high enough for when restrictions were eased in most settings. So probably restrictions could have been eased a bit slower. There was a lot of pressure, of course, from the coming summer tourist season. And now we see some of those results and those restrictions coming back. I think in particular, we need to target young people, as was already mentioned, but also look at the conditions that's facilitating spread. So, for example, there's been a lot of talk about spread at the beach. It's probably not so much spread at the beach as it is at the snack bars, at the bathrooms, at the crowded showers and areas around the beach. So those are quick fixes. We know where the spread is happening, and the government and authorities need to get better at making it easier for people to be outside and enjoy their summer holidays.
Just briefly, do you think if this carries on, are we in for a period of more confinement, more restrictions into the winter?
Well, if it continues and it continues escalating, there'll definitely be more restrictions. We've already seen countries, including Spain and in some of the regions, reducing the numbers of people who can be together from 1,000 to 500 to 100, and even in the Basque Country to 10. Nobody wants a lockdown like we had earlier in the year. So that message needs to be made very clear that if we don't take the necessary precautions, we're going to have that lockdown. But I think there's still a lot of things we can do. Hand sanitizer needs to be more widely available at the shops, in the restaurants, and in the bars. Face masks need to be made free to the farm workers and other vulnerable populations. So there are still, I think, steps that I would call quick wins that can be taken. And I'm not sure that the kind of community or the widespread spread of COVID-19 in the community is like it was earlier. We're detecting a lot of more asymptomatic cases. They were probably there earlier as well. We just weren't testing as many people. So we want to make sure we don't punish countries that have scaled up testing. We need to make sure that along with the scaled up testing, they also put in these measures that I already mentioned and that really aren't new. What's new?
Dr. Lazarus? Dr. Lazarus, sorry, we've run out of time. Thanks very much for joining us there, Dr. Jeffrey Lazarus for the Barcelona Institute for Global Health. Still to come.